Thank you very much. It is really my pleasure to introduce our next witness, Gary Westfall Livengood. He is a graduate of West Virginia Institute of Technology with postgraduate training, University of Maryland and University of Virginia. Mr. Livengood has a background which really is relevant to what we're discussing today. First of all, you started out as a journalist in the U.S. Army. Thank you, sir, for your service. You organized, developed, and directed all functions for claims offices in a 29-state region for a self-insured rail transportation corporation. You directed the overall marketing and operational efforts for a 14-office company, one of the nation's largest investigative services companies. You had operational responsibility for a 200-member cost containment department within a large regional health maintenance organization, really relevant to what we're talking about today. And now you are principal of What a Stitch for operational, financial, as well as federal and state compliance responsibilities for an embroidery small business with 21 employees, providing apparel enhancement for companies and individuals, principally throughout the Mid-Atlantic region. Thank you very much to Capitol Hill and our hearing.
Thank you, sir, and good morning. As I was indicated, my name is Gary Livengood. I am a principal of What a Stitch LLC, which is a small commercial embroidery business in Mount Airy, Maryland. I'd like to thank the members of the Small Business Committee for the honor of testifying before you today about the health reform law. Tell you a little bit about me. After serving my country in Vietnam, I worked in a variety of operational positions from various industries for over 35 years. Then my wonderful wife, Luann, somehow got me to agree not to spend my retirement on the golf course like I planned, but rather on helping to grow her hobby into a business that now employs 21 people. We started What a Stitch in 2002 with one single head sewing machine. The company grew and grew, but then like business owners everywhere, 2008, 2009 hit. We're very committed to maintaining the business and keeping the employees, so we dug very deeply into our personal savings just to keep the doors open, and we were able to do that. Times still aren't great for us, but they're better than what they were. I wish I could say that even better times were ahead, but unfortunately the future continues to look uncertain. I know the intent of the new health law was to help business owners like us, but thus far I don't see it. The new law weighs heavily on my mind anytime we're thinking about hiring new employees or what the future may bring for our small business. It's already put regulatory burdens on our company, and then I suspect that there are more compliance issues that are going to be coming forward. Before we started What a Stitch, my wife was a director of human resources with Amtrak, and I spent my last 13 years as a vice president of operations with United Healthcare, well, eventually with United Healthcare. So we may be a little bit more conversant about the administration of group health insurance than your average day-to-day small business owner. Consequently, the day-to-day reliance on our healthcare agent, Paul Yonkins, who's also the co-owner of Allied Resource Management, isn't as extensive as many small business owners. But even with our experience, Luann and I just wouldn't consider dropping the services of our agent. He's our insurance policy within an insurance policy. And so far, our company's been very lucky. We haven't had claims, disaster, or medical crises that require the full use of Paul's capabilities. But I know that Paul and some of his clients do, and other agents like Paul have far-reaching services to small businesses across the country. But I understand that our company could experience similar needs at any point in time. If and when that day comes, I want employees and the family to have somebody that we know and can trust at no additional cost, so that my wife and I they'll get the job done for us, and my wife and I can concentrate on keeping the company profitable. Paul, on the other hand, is a businessman like me, and he deserves to make a fair living. And when I pay our company's insurance premiums each month, it's clear that a portion of my check is really our agent's fee. That's included in our tax bill for tax and convenience purposes. It's also obvious that our company's total insurance premium rate has nothing to do with the amount the agent gets paid. Our premium costs are driven by the cost of medical care in Maryland, as well as the age and the size of the group of our employees. Paul's fee is just a small percentage of whatever our insurance premium will be, and it's worth every penny. Unfortunately, it's my understanding that the new health reform laws' medical loss ratio requirements are hurting Paul's business and similar business nationally. My company went through several years of declining revenue, so on a personal level, I feel for Paul. But I worry about the impact that it's going to have, and if Paul needs to change the nature of his business and can't afford to handle our account anymore, we may have to seriously consider just dropping our group coverage, saving the money that we put into our employees' premiums. And if the government takes over such benefits and administration, I'm hard-pressed to believe that we will continue to have the same kind of access to customer service that Paul currently provides. And I see my time is up, so I thank you for the honor of testifying before this committee today.